and gentlemen, let's welcome with a resounding round of applause the MC of the summit, Fortune
Nimeli. No, your energy is low. Nimeli. 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 A resounding round of applause, everyone. Yay! The feeling is so great. We are super excited to be here. I heard something that broke my heart just now when we're coming in. I saw a couple of boys saying that almost a program near man and Kwadia. Oh, isn't it sad? And so if you are here, you have to count yourself privileged that you're going to learn a lot. Let's give it up again for ourselves. I spent close to a decade here teaching. And it felt right that we came back to do what we are coming to do with you. My name is Fortune Mokoko Adalavo, and it is the biology of the Girl Child Summit. We are coming to life from the Great Hall of Adan Senior High School. Let's give it up, let's give it up, yay! And even before we set the tone and pace, if you've seen our banner outside, another thing that is exciting me, ladies, another thing that is making me super excited is the fact that we have about 4 of our resource personnel being Nimelis. Does that ring a bell? And your headmistress will tell you, she was part, I was part, your chaplain was part, a number of the teachers here were part, who taught all these people. And we again are so happy. You know, that is one of the fulfillments you get as a teacher. When you give it so much, you know, and then you're able to see your girls, your students manning up, getting to very wonderful positions, and they go like, Madam, you've done so well for us. That is why they are here. Are you happy to be a Nimeli? Yeah. No. Are you happy to be a Nimeli? Yeah. Alright, we are ready to roll. And I'm again going to invite somebody that I call my father, a big brother, an uncle, and everything. At a point he saw my tears, at a point he saw my smiles. Let's welcome Reverend William Y. Ankla to give us the opening prayer.
Thank you, Madam Fortune. We are happy to see you back. And we're also happy to see our facilitators. Oh, let's give it up to them. We are so grateful for this day. And we are happy. And before I pray, one thing that you should know is that anytime we bring people here, it's not for fun. We bring them here so that you can tap from them. Are you here? Yeah. Now, when you see them, when you hear them, the story should be that me too here in Adan School, I can make it. Hello? Hi. I can make it. It's not a negative aspect that, no, you need to build on. Let no one tell you that Adan School is a village. Hello? Hi. We have a lot of people who have gone through the 4 walls of this school and they are doing marvelously well. And you are no exception. Amen. Amen. Shall we pray? Father, we thank you so much for this wonderful day. The early showers of this day tells us that indeed you are with us. We are grateful for the gift of life. We are grateful for traveling mercies. And we are grateful for this program. It's our prayer that, Lord, even as we sit at the feet of these wonderful facilitators, impartation will take place. And we'll also rise up and even be more than them and give back to society. We pray that, Lord, you open our minds and help us to understand every little aspect of this. Help us to feel special as the girl child. And let us know that, Father, even as girl child, there is no limitation. We thank you for our facilitators. We pray that you give them the energy to be able to bless us. Carry us through the program. In Jesus' name, amen.
Amen. So let's have a deal. Whenever you have a presentation taking place where the person is done, and then I'm running to come here, what you need to do is to give them a resounding round of applause. Is that okay? Do we understand ourselves? Okay, another big round of applause for Reverend Antra. We are ready to have the welcome address. And I'll tell you this. We didn't have to break protocol in any way. We are on the soil, on the land of Adan. And we are privileged. I'm blushing already. The second female headmistress that the school has ever had. Are you happy? Yes. Let's welcome the headmistress, Mrs. Adlund Abayatai, as she gives us the welcome address. A resounding round of applause, ladies and gentlemen. It is the biology of the Girl Child Summit, and we are yet having the welcome address. Grace.
Before my address, I equally want to express my excitement for having my old girls here and then an old teacher. Barely 2 weeks ago, in a meeting in the staff room, I was bragging with Fortune Moboko Adalibo as one of the best biology teachers in this school. I was telling my staff, she and a colleague, Belinda, they made biology exciting for the home economic skills. And they were passing as if it wasn't any difficult subject. Thank you. On behalf of the management, staff and students, I warmly welcome the GIMAT Volunteer Network to Adan Senior High School this morning. We are honored to host you today and deeply appreciate your commitment to service, collaboration, and girls and community development. Your presence here is a great inspiration to us. It reflects your dedication to supporting educational growth, youth empowerment, and sustainable development. We believe that today's engagement with our girls will create meaningful learning experiences that will strengthen partnerships and open doors for future collaborations. We are grateful for your interest in our school and the opportunities your visit brings. May this visit be productive, insightful, impactful, and memorable for us all. Once again, we say a warm welcome to the GIMAT Volunteer Network and say, all of us, avail yourselves to be blessed. Thank you.
Thank you very much. Let's give it up, let's give it up, let's give it up. Thank you so much, madam. All right. Now, we need to know the chairperson for this historic moment. And to help us do the honors, your own, the head girl. Let's welcome Estelle Wubel, Princess, as she gives us the introduction of the chairperson of this great biology of the Girl Child Summit at Dance Edition. There she comes. Let's welcome herself. Let's welcome herself. A very cute girl. My. Great, great, great.
The headmistress, distinguished guests, honorable staff members, fellow students, ladies and gentlemen, good morning. It is my great pleasure to take a moment to introduce the luminary who will be steering today's proceedings with wisdom and expertise. She is an accomplished academic researcher with experience in mathematics, statistics, and ICT. She holds a PhD in mathematics from the University of Mines and Technology in 2023, with prior degrees in statistics MPhil 2012 and mathematics and ICT education in 2008. Her work focuses on statistical modeling, time series analysis, demography, and promoting ICT and mathematics education for all, especially young women. She has over 15 years of teaching and leadership experience, currently serving as a lecturer and principal tutor at Adam College of Education. Her roles have included team leader for mathematics and numeracy. She is proficient in statistical tools such as R, SPSS, and STATA, and is recognized for her leadership, problem solving, and teaching excellence. She has received awards including Best Mathematics Tutor in 2010 and Best Mathematics Teacher in 2001. She has also contributed to numerous professional development workshops and conferences focusing on mathematics education, ICT integration, and lifelong learning. She is in the person of Dr. Eunice Osei Asike. Without further ado, let's accord a warm welcome to Dr. Eunice Osei Asike.
Let's welcome the sons of Dr. Eunice Osei Asike. Yes, mathematics. PhD in mathematics, girls, that is not a joke. We can do it better. Thank you so much, Doc.
Good morning, girls.
Good morning.
Nimeli.
Hello.
Nimeli.
Hello.
Are we taking our breakfast?
Yes.
Not yet. Don't worry, when you finish, when we end, see me. But by the time we finish the program, you know if you feel hunger. Nimeli.
Hello.
Thank you. Welcome to the Biology of Girl Child Summit, Adako edition. And I'm honored to chair this incredible event. As I've watched Biology of Girl Child grow, I'm thrilled to be part of this journey. Today, we are gathered around a powerful theme, empowering girls, enriching Ghana, a summit for educational excellence. To our ladies, I want to tell you that I'm here because I believe in the power of education, just as the theme says. Through education, dedication, and His grace, since I've gone through the books and crannies of education to earn my PhD in mathematics, I am committed and inspired that I always want to keep up the fixed mindset and change it to a growth mindset. We always have a fixed mindset, and I always want to change it to a growth mindset. I want to see more girls taking up roles in male-dominated spaces, breaking the barriers and shuttling glasses ceilings. The summit lead, let me tell you a little thing about her. Miss Fortune Mokoko Adalibo was a baby I carried on my back way back in the 70s. I carried her. In the early 80s, but through her dedication, willing to do it, and her education, and not forgetting the grace of God being on her, she has equally gone through all books, and now she is here with us doing all these things. Let's give a round of applause to her. for you. When I mean you, the lady or the girl child here. We are here to guide, support, and cheer you on. We believe in you, and we know that with education, you can achieve anything. So, how do we get there? It's by learning, by following the steps of women you wish to become, and by believing in yourselves. Surround yourselves with people who will inspire and motivate you, and never be afraid to take risks. She really took risks, and now she has gotten to where she is. So make up your mind that you take risks, and truly you get to where you are. Remember, your education is a powerful tool that can take you places. Use it to empower yourself and others. Not forgetting what Peggy Agri said. If you educate a man, you educate individual. But when you educate a woman, you educate a whole nation. So as we are educating you, we are educating the whole nation Ghana. So let's work together to shape a brighter future for our nation Ghana. Let's all say, yes, I can.
Yes, I can.
Yes, I can.
Yes, I can.
And the third one, yes, I can.
Yes, I can.
So if yes, you can, then let's get started. Thank you.
Hello. Hi. Let's get started. Let's give it up again. We are getting started. Are you ready for the first speaker?
Yes.
Do you know what all this is about? Let me tell you briefly. So for some of us, it took us 13 good hours to be here. Others too, it took them 6 hours to be here. We have another team members, others that took them almost 4 hours to touch down. So it should tell you that this means a lot to us. Why are we doing this? We want our girls not to quail when they meet other girls from the so-called big schools, when they meet people from the so-called big cities. I'm using the so-called because society has decided to define certain places as being big, other places as being small. So wherever you find yourself, wherever you're coming from, this summit is to tell you that it doesn't matter where I'm coming from. It doesn't matter whether my dad is a fisherman. It doesn't matter whether my mom is a market woman. What matters is that I am in a dance school and I'm going to get to the top. Are you happy with that? Let's give it up again. And so our first presentation is going to be on your biological cycle. What processes do you go through as a young girl, as a female, as a woman? So we have a presenter whose job is to take you through the biological process of ovulation, the biological processes of menstruation, and then the top on our list, teenage pregnancy. We keep saying this. You can be so smart, you can be very intelligent, but then your journey can be truncated when you get pregnant along the way. And I believe you agree with me, right? Yes. The first person to do as the honors is Eminelli belonging to the year 2015-2016, currently practicing at the Rich Government Hospital, Accra. Ladies, let's welcome Dr. Manasseh Kofinati as he takes us through the first presentation. Oh, and let me tell you, I taught him. And then your headmistress, Mrs. Abate, also taught him. Oh, he's love with someone. Where is Reverend Ankara? Willie, where are you? He also taught him. Take it away. Let's welcome him with a round of applause.
Good morning, everyone.
Good morning.
How are you all doing?
Yeah, all fine.
I can't believe it's nearly a decade since I left the walls of this compound. I'm having goosebumps. I hope you are all doing well.
Yes.
So to add to what Professor has already said, okay, I'm here to talk about certain physiological changes that happen in your body: ovulation, menstruation, teenage pregnancy. Okay, it's a bit, even in medical school, this topic is very difficult. Okay, and so coming to talk about such a topic with you guys has been a challenge. I don't know if I should talk about, because I know you have science students over here as well. And then because of them, I need to go deep into it. I need to also consider the fact that we have some other people that once I go deep into it, they won't be able to appreciate the whole thing. But I know that I'll find a way to deliver the message and then everyone will benefit. Is that okay? Yeah. Alright, so as what Professor has already said, that we should transition from a fixed mindset to a growing mindset, okay? The battle is won in the mind. And so once you tell yourself that you can do it, automatically your mind and your body are in tune. Is that fine? Okay. So the menstrual cycle, ovulation, menstruation, and pregnancy. Okay? So here is where I want us to start from. The very first day you start menstruating, we call it day 1. Are you following? Yes. I need you guys to follow, okay? The very first day you start bleeding, you start menstruating, we call it day 1. And hypothetically, the bleeding should last for maximum 5 days. Is that fine? Are you guys here with me? Yes. Good. So the bleeding should last for 5 days. Okay? And then from the 6th day to the 14th day, your body is preparing. Your body is preparing for eggs to be released again. You understand? So the eggs are being released on the 14th day. Okay? So the eggs are released, and then if there's a sperm in the body around that time, there is what we call fertilization. Are you getting it? But obviously, and then obviously again, there will be sperm over there because of where we find ourselves now. You understand? And so from the 14th day to the 28th day, because sperm hasn't been in the system for embryo to form or for baby to start developing, on the 28th day, the egg together with your endometrium, the endometrium is the lining of your womb, the lining of your uterus, it breaks. And as it breaks, you bleed, you menstruate, and then you come back to day 1 again. You understand? Yes. Are you sure you're following? Yes. You're following? Yes. Okay, so day 1 is when you start menstruating. Okay? The menstruation lasts for maximum 5 days. Of course, we have individual physiological differences. Some people it will last more than 5 days, maximum 7 days. Some people it will last less than 5 days. It becomes pathological. If I say pathological, it becomes like a disease condition. It becomes concerning if it lasts more than 7 days. It becomes concerning if you bleed less than 2 days. Are you following? Yes. Okay, so I'm saying that from day 1 is when you start bleeding, you start menstruating, okay? From day 1 to day 5 is when we say you are menstruating. From day 6 to day 14, your body is preparing for new eggs to be shed. Okay? Once the eggs are being shed and there's sperm, then you get pregnant. Once you get pregnant, that cycle breaks. I hope you know that if you are pregnant, you don't menstruate. Yes. You know that? Yes. Okay. Alright. So I will take each of the steps and try to explain what the processes that goes on over there. Is that fine? So now we know that from day 1 to day 5, you are menstruating, you are bleeding. Okay? From day 6 to day 14, your body is preparing to release eggs. This is what happens. A part of your brain we call the hypothalamus, okay, sends a message to another part of your brain we call the pituitary gland. Okay, so this gland releases a hormone we call follicle stimulating hormone. Are you following? Yes. So this follicle stimulating hormone, good, before I even continue, right at birth, every female has a complete set of eggs in your body. Okay, so right at birth, a female has, say, 1,000 eggs, but those eggs are premature eggs. A female may have 2,000 eggs. Those eggs are premature eggs. Okay, so when the information from your brain gets your pituitary gland to release the hormone I just mentioned, the follicle stimulating hormone, this follicle stimulating hormone starts, or it initiates the maturation of an egg in your body. You already have a reserve of eggs in your body. Is that fine? Are you following me?
Yes.
Okay, so you already have reserved amount of eggs in your body. So every month, an information is being sent for maturation. The eggs, the premature egg undergoes some processes to become matured, and then on day 14 is being shared, is being secreted into your system. So the hormone that influences this process is called the follicle stimulating hormone. So the premature egg undergo certain changes. Okay, we have the early stage, the second stage, and then the mature egg is called the Graafian follicle. So day 14th is when you ovulate. It's when the egg is being released. So around day 14, this Graafian follicle bursts, and then it releases the egg. This process goes on in your ovaries. So here is the thing too. We have 2 ovaries. How do we know that?
Yes.
So 1 month. So this is how they function. They function every other month. So if this month 1 ovary release the egg, the following month the other ovary does the same thing. Okay. So the Graafian follicle, which is the matured egg, which is the mature follicle, bursts to release the egg in your ovary. Have you seen an ovary before? No, you've not seen an ovary before, but you've seen it in textbooks, right? Okay. So I don't have the diagram of it, but you realize that the fallopian tube is close to where the ovary is. So once the ovary bursts, once the Graafian follicle bursts to release the egg, the fallopian tube has something we call fimbriae. It's like, do you know flagella? So it has a cilia. So it sweeps the eggs back into the uterus. Okay? So once the egg is released, the fallopian tube is in close proximity with the ovary. Okay? So once the egg is released, it sweeps the egg back into the fallopian tube. The end of the fallopian tube that carries the egg into the fallopian tube, we call it the fimbriae. Okay? So this egg comes into the uterus through the fallopian tube. This ovulation happens around day 14th. And then, like I mentioned, the hormone that stimulates, that initiates this process is called the follicle stimulating hormone. So you have the egg in your body. The egg has a maximum of 24 hours to stay in your body, after which it's dead. Okay? So day 14th you menstruate. Sorry, day 14th you ovulate. There is mature egg. There is egg in your body. It has maximum 24 hours to stay in your body. And then sperm has between 3 to 5 days to also stay in your body. Which means that if there is sperm cell in your body, let's say 2 days before you ovulate, you can get pregnant. Are you following? Because the sperm can survive between 3 to 5 days. Okay, if you have sperm in your body between these days, you can get pregnant. The egg itself has a maximum of 24 hours to stay in the body. It's between 12 to 24 hours. So this egg comes to your fallopian tube. There is no egg over there. This is what happens once the egg is released. Then another hormone is being secreted. We call the hormone progesterone. This is what this hormone does. This hormone will thicken your endometrium. Endometrium is where the baby will live if you get pregnant. Okay? So this progesterone has to prepare that place because there is egg in the body. So your body is trying to prepare itself for pregnancy. Okay? So this progesterone will thicken the endometrium so that once you get pregnant, the embryo that is formed will have a good environment to survive. So the progesterone thickens the endometrium, it vascularizes the endometrium. What I mean by vascularization is that a lot of blood supply has to be there because once the embryo is there, the embryo needs like nutrients, and these nutrients will be delivered through these vessels. Okay. There's another important thing that this progesterone does. It creates a thick cervical mucus that will block your cervix, so that at that time nothing can get into your uterus. So there are 4 things. You've ovulated, the egg is in your fallopian tube. Your body is preparing to get pregnant, okay? A hormone called progesterone is secreted. This progesterone will thicken your endometrium in preparation for implantation. This progesterone will cause vascularization of the endometrium of the uterus for pregnancy. This same progesterone will cause a thick mucus to block your cervix. You know, for anatomy, we have the vagina, the cervix, and the uterus. The uterus is where the baby lives. Are you following? So this progesterone will create or will help the body to secrete a thick mucus to block that side, so that nothing goes inside. Because at that part, it's critical that we create a very good environment for the developing embryo. Do you get it? This happens around day 4 things when you've ovulated. So here is the thing. If fertilization doesn't happen, there's no egg, there's no sperm there to fertilize the egg. Okay? This is what happens. This progesterone levels starts to decrease. Remember that we have these high levels of progesterone levels in your body because your body has to be prepared to receive the embryo. Are you following? Yes. Are you following? Yes. Okay. So, but there's no sperm, so there's no fertilization. So this progesterone begins to drop. As this progesterone is dropping, mind you, the progesterone is there to create an environment, to create vascularization of the endometrium of the uterus. It's there to thicken the endometrium of the uterus. But they are not pregnant, and so levels of this progesterone begins to drop. So the drop in levels of progesterone starts from day 14 to day 28. Are you following? Yes. By day 28, progesterone levels drops completely. The progesterone is what is holding your uterus. It's what is holding the endometrium of your uterus. It's what is creating the thickness, the vascularization, and then the cervical mucus plaque. And the levels of these hormones are dropped by day 28. So when that happens, you shed the layer of your endometrium as menstruation, and then it starts from day 1. Are you following? Yes. You got in the picture now? Yes. So menstruation starts from day 1 to day 5. You've menstruated. From day 6 to day 14, your body is preparing to release eggs because you didn't get pregnant. On day 14th, hypothetically, on day 14th, your body releases the eggs. Once the eggs are being released, there is a hormone we call progesterone, which comes to prepare your endometrium for fertilization if there is sperm to fertilize the egg at that time. Okay? So I mentioned the preparations to you. The endometrium. So the endometrium is like the inside of the lining of your uterus. Okay? Where the implantation happens. It will thicken it. It will cause vascularization. It will cause a lot of blood vessels to develop, so that in the event where we have the embryo formation, the growing baby or the embryo gets a lot of nutrients from the blood vessels. It also forms a mucus plug to prevent things from ascending into your upper genital tract. You are not pregnant, so your body realizes that, and the levels of this progesterone drops by day 28. As it drops, there's nothing to hold the thickened endometrial layer, and then you shed that whole layer, which comes out as menstruation. Are you okay? If you have any questions, you can ask before we move on to the next discussion. Are you okay?
Yes.
I'm sure you're okay.
Yes.
You have a question? Okay, alright. So the next topic we'll be discussing will be vaginal discharge. But before we get there, I want to summarize the menstruation and ovulation thing for us again. Okay? The very first day you start bleeding, you start menstruating, you see blood because it's day 1. It's usually supposed to end by day 5. Okay? Of course, I mentioned that we can have instances where some people will menstruate for 7 days, some for 4 days. Okay? So by day 5, you should stop menstruating. From day 6 to day 14, your body is preparing to release another egg. And then I mentioned that there is a hormone we call follicle stimulating hormone. This hormone is released. This hormone is released to go and act on the premature egg that you already have in your body. The egg matures into what we call Graafian follicle. Day 14, this Graafian follicle bursts. It releases the egg into your body around day 14. This egg has maximum 24 hours to be in your body. It means that within that 24-hour period, if you have sex and sperm gets there, you'll be pregnant. It means that before even ovulation starts, because sperm can survive in the body between 3 to 5 days. If you have sex, say 3 days prior to ovulation, you still get pregnant because the sperm is still going to be in your body waiting for the eggs to be released around day 14. Are you okay? After ovulation, after the egg is being released, progesterone hormone goes up. This progesterone hormone prepares your body for implantation. This progesterone prepares your body for fertilization. And so where the baby will grow, we call it the uterus. The lining of the uterus, we call it endometrium. This progesterone will cause the endometrial lining to thicken. It becomes thick. Okay? There is increased blood supply to the area, vascularization. And then for the anatomy, we have the vagina, we have the cervix before we get into the uterus where the baby lives. This progesterone will form a thick cervical plug to block your cervix so nothing goes into your vagina, because at that time, should fertilization happen, the baby or the growing embryo needs a very good environment to be able to grow. This happens around day 14. There's no sperm, no fertilization. Okay, so levels of this progesterone begins to drop. It begins to drop, and then it drops to near nothing around day 28. So once levels of this progesterone drops, what holds your endometrium, the lining of your uterus breaks, and then you menstruate. So back to day 1 again. Are you okay? Let me explain why during menstruation you have cramps, okay? So the uterus has to contract. If I say contract, it has to like contract. Okay? So it pushes we call it basilis layer of the endometrium out. Because the uterus by itself can't cause blood to come out. It has to contract. Okay? And then you bleed. Is that okay? Are you okay?
Yes.
Good. Again, again, so it means that after every 28 days, you should menstruate. It's different for every individual. So we say after every 28 to 35 days, because the cycle is specific for each and everyone. So after every 28 to 35 days, you should menstruate. You should bleed for at least 5 days. Some can bleed for even 7 days. Okay? Are you okay?
Yes.
Okay, so the next thing we talk about is vaginal discharge. So your vagina, there's something we call flora. F-L-O-A-R. Flora is an organism that is living in an area where it wouldn't cause any disease. And so as I'm standing now, in my mouth, there are microorganisms in my mouth. But I don't have any infection in my mouth because those microorganisms are not like those microorganisms are supposed to be in my mouth. In my stomach, I have microorganisms over there. Don't cause any infection because they are supposed to be there. In your vagina, you have microorganisms that are supposed to be there. So we call them normal flora. When they become way more than the number, then you go into a disease state. So for the vaginal discharge, there is a normal discharge. Every woman will discharge. Okay? But when the organism colonizing the area becomes way more than the level is supposed to be, then you start to show some signs and symptoms of infection. So basically we have 3 infections. We have Candida, we have bacterial vaginosis, we have Trichomonas vaginalis. Okay, so I'll talk about each of them. So for the Candida, you realize that you are discharging a very thick discharge. The discharge is thick, and then your vulvar area is itchy. You are discharging, it's thick. It's like condensed milk, very thick. And the place is itchy, but it's not foul smelling. Are you following me?
Yes.
So if you notice that you are discharging, you check the discharge. Usually the color is whitish or cream. It's whitish or creamish in color. And it's thick. And the whole place is itchy, but it's not foul smelling. They should know that you have Candida, you have candidiasis. Are you getting it? Yes. Okay, there is another type, the one we call the bacterial vaginosis. That one, the discharge is not itchy, but it's foul smelling. It smells so bad. It smells like rotten fish. Do you get it? And this is not for you. This is for the adults amongst us. So when they come to see the doctor, they'll tell you, "Oh doc, please, my husband has stopped having sex with me." Because once the sperm goes in there, the smell that comes out is so bad. So they are passing stop having sex with them. I know you guys are not having sex at this time, but I'm just sharing this information with you. Okay? So, hello. So for the bacterial vaginosis, it's not itchy. Okay? But it smells so bad. And the color of the discharge is grey. Why? Okay. So then we are coming to the last one. We call the Trichomonas vaginalis. That one, the discharge is itchy and it's foul smelling at the same time. And the color is greenish. Are you getting it? So once you notice any of these, then you have to see the school doctor. You have to ask to see a doctor. Okay? I don't want to talk about the treatment because I don't want any chance where you guys will go and self-medicate. But once you notice that I'm discharging, the whole place is itchy. And it's not foul smelling, you have candidiasis. Okay? Talk to talk to like the headmistress, talk to your teacher, talk to your mom, so that you seek treatment. Once the place is itchy and it's foul smelly too, then you should know that something is going on wrong. And then here is the catch. You don't have to do anything to have this end of this infection. So you don't have to do anything. You can be here, you can be how do I even put it? Like you don't have to have sex to get vaginal discharge. If your body state is immunocompromised in any form, maybe you are stressed and your immune system breaks down, the normal flora that is supposed to colonize your vagina becomes empowered because your immune system is weakened. You're preparing for exams, you are stressed, your immune system has broken down. The organisms that are supposed to be normal flora for that part get overpowered, and then you may experience any of these infections. Are we okay? Are we okay? Yes. So I think this is where I'll bring the presentation to an end, and then I'll take all the questions. And then some of the questions are peculiar, so I need to treat some of the questions. I need to treat some of the questions with confidentiality. Okay. So if you are asking a question, it has to be about understanding of what is going on. I mean, it could be you, but you could create research that my sister this, my friend this, I've experienced this in the past, so that you don't get stigmatized among your peers over here. Are you following? Yes. Because I mean, some of this, like the person she asked, I'm supposed to see her behind closed doors in the consulting room, but of course I know that quite a number of us may be going through the same thing, so I don't mind explaining. Okay, but you can go ahead and ask the questions. If I see that this question I would have to talk to you one-on-one, then I will tell you and talk to you one-on-one. Is that fine? But ask me all the questions. Okay? Is that fine? Yes. So the cycle length is 28 days. Okay? So if you start menstruating from 1st January and then you bled for 3 days, by day 3 you are done with menstruation. By 28 days after the 1st day, you should menstruate again. Are you getting it? Are you getting it? Unless of course your question has got to do with these 28 days and not January, February, March we are talking about. Do you understand what I'm saying? So here's the thing. If you start menstruating 1st January and then your cycle, your bleeding cycle ends on 3rd, okay? From 1st to 28, you should menstruate again. That doesn't mean you are menstruating 2 times in a month. That's your cycle length. Your cycle length is not based on the calendar we have. Are you following me? Yes. Can I answer your question? I want to hear here. I've answered the question. Okay.
Please, what if your menstruation delayed before coming, and when it was coming to it will take only 3 days, and it will wait for another 2 months before it will come again?
Okay, so I'm coming. Please, I'll ask some questions. Please, no, you should have to speak microphone. How long has this been going on for?
For a very long time.
Very long time, 2 years, 3 years, 4 years, 5 years?
2 years.
2 years. So before 2 years, your cycle has been normal. Every 28 days you menstruate.
No.
So now I want to know when you started experiencing this. Or you started menstruating 2 years ago.
Yes.
And that is how it started for you.
Yes.
Oh, okay. So it means this is unique for you. Okay. So let me understand your question again. When you say first, you said your cycle, you start menstruating late. When you say late, what do you mean? I can't hear you. Oh, that's shy. The starting day. So let's I'm asking. age. Okay, so we call that menarche. So menarche is when menarche is the age at which you start menstruating. Is that what like she meant? How old were you when you started menstruating? 16. 16 is good. It's okay. Yeah. No, but I think. Hello. Hello. That's not the question you asked. You are shy, so you don't want to go ahead. I want to talk to you. That's not the question you asked. Because if you start menstruation at age 16, I mean it's normal. Menstruation should start around 14, 15, 16. That's not the question. So will you ask me the right question? You see 101? Okay, alright. Before I take your question, let me use this opportunity to explain this to you, okay? Before I take your question, okay? So, when your body is exposed to a lot of these hormones, let me use this opportunity to talk about something called uterine fibroid, okay? So this is what happens when if you menstruate every month, for a long time, you are at risk of developing uterine fibroid. We know that once you are pregnant, you don't menstruate. There's something, and then after delivery, if you breastfeed exclusively, you won't menstruate as well. And so it means that if you are pregnant in your lifetime, if you are pregnant, you don't menstruate for close to 2 years. You are reducing exposure to estrogen and progesterone, and this reduces the risk of getting uterine fibroid. Are you following? So this is to say that if you start menstruation late, in a way it's good, because the body's exposure to estrogen and progesterone is low. Okay, so if you start menstruation late and menopause sets in early, it helps. It's a protective factor for uterine fibroid. Okay? Okay, alright, so you can ask your question.
How many more can we take? Let's take 3, unfortunately. And I'm reliably informed that a lot of you have very private questions you want to ask. He will listen to you. So let's just take one from there, take these 3, and then we are good to finish up for this segment. Okay. Okay, she wanted to talk. Faith, let her talk here. Then we go to Philippa. We'll come to you with your group. Then we come to this side. Yes.
Please, I started menstruating at the age of 18. And when I was menstruating, I was taking folic acid. So when I was taking folic acid, I used to menstruate about 5 days. But I stopped taking it and I started menstruating only 2 days. So I'm asking, should I still go into the folic acid or I'm normal with the 2 days?
Okay, so the folic acid has nothing to do with the menstruation. Here is the thing, when you menstruate, you are bleeding. So your HB level drops. The folic acid just helps to build up your HB. You understand? So the folic acid has got nothing to do with menstruation. It doesn't play any role in menstruation. I'm sure the person who advised you to start taking the folic acid did that because they don't want you to be anemic. If you menstruate, you lose a lot of blood. You get what you call anemia. Your blood levels drops. Okay, you call it HB. Your hemoglobin level drops. So the folic acid just helps to synthesize more of those hemoglobin. Okay. All right.
Please, I want to ask, why is it that some people experience their menses 2 times in a week? 2 times in a month.
Okay, all right. So again, I'm assuming that the 2 times in a month is not the beginning of the month and the ending part of the month. It's like maybe happening within a short interval. So this whole cycle is being influenced by hormones in our body. Okay? And so to a larger extent, you don't have any control over that, over why you menstruate twice. Okay, but here is the thing. If you realize that it's pathological, then we put you on drugs. We put you on drugs. So those drugs will make the body act like, oh, we are menstruating at this point, so that follicle stimulating hormone is not being released to cause growth of the egg. Are you getting this? And so if you realize that you menstruate twice every month and it's not good, we'll give you medication. We call them OCCP. We give you those medications so that at a point in time, your body assumes there is that placebo effect on your body to assume that, okay, I'm menstruating now, so that the eggs are not being matured for you to menstruate again. Do you understand? But it's not normal to menstruate twice in a month, unless of course it happens like once every year, once every 2 years, which happens in a lot of cases. Okay, so if that has been going on for some time, then you need to see an obstetrician gynecologist. Okay, you need to see a doctor. Is that fine? Or you need to see me? Yeah. So last question. Why are the guys not asking any question?
Please, I want to ask if you have the whitest discharge for about 2 days and 3 days and then it stops, and 1 week later it comes again, does it mean you have infection?
Yes, please. So if the discharge fits into any of these criteria, if it's itchy, if it's foul-smelling, if it's itchy and foul-smelling, it means you have an infection. Okay? Yes.
Please, I want to ask that at this age, if you are not menstruating, is it normal?
How old are you, please?
18.
Medicine is unique and of course broad. 18 by 18 you should be menstruating. But again, we have, like I said, we have certain physiological changes that are normal. Okay, our heart is here. Our heart is located in the left part of our chest. But there are few people that have their hearts here, the tachycardia, and they are living life well. It is normal for them. Do you understand? So the cutoff 18 is like very high, but I won't say it's abnormal. Do you get it? Unless the only way I can say it's abnormal is if I run other tests, and then if I run other tests, that tells me that, oh, you don't have ugonio, you don't have reserves of eggs in your body, or you have hormonal dysfunction, and so your body is able to produce follicle stimulating hormones, your body is able to produce progesterone, estrogen, then that's where the problem is. Then you can tackle it from that side. But all things being equal, if you are fine, you don't have any hormonal issues, your egg reserves is intact, genetically everything is fine with you, then your menstruation will come. Okay? Okay? Yes. Is that the last question? You have a question? So I want you guys to stop calculating your menstrual cycle using months. Count the days. After every 28 to 35 days you should menstruate. Do you understand? So if menstruation starts today, that's day 1. So it comes from the day you start menstruating to 28 days. You should menstruate from that 28 days to 35 days. Are you guys following? So stop using January, February, March, December. No. Start counting from the day you start menstruating. Okay? Alright.
I want to ask that, is it normal for a lady to have a white vaginal discharge after her period almost every day before her next one?
Yes. It's normal. Is that before your period, right?
Yeah.
Yes. So there is something I didn't mention. There's something I didn't mention. You remember I said the follicle stimulating hormone cause maturation of the egg to become Graafian follicle. Okay? So when a follicle stimulating hormone is released, there's a hormone we call estrogen. This estrogen helps for, it also plays a part in the maturation of the egg. What the estrogen does is that this is what the estrogen does. The estrogen produces a thin mucus substance. The progesterone, I said, produces thick to block the cervix, but the estrogen produces thin, watery, mucus substance around your cervix, and it's because it's making the place favorable for sperm to swim. You understand? So this process is going on. It's going on till day 14 when you are supposed to ovulate. This estrogen is preparing thin, like mucus, thin mucus secretion into your cervix, so that once sperm gets there, the sperm will get a good environment to swim to go and fertilize the egg on the 14th, the 15th when you are ovulating. So it's normal to discharge around that time. Have I answered the question?
Okay. Please, I want to ask, the blood that has been flowing, where does it come? Does it come directly from our body? If no, then why is it that after menstruation, like I feel dizzy and then weak?
Okay. So the blood, I would say, comes from your body, but this is how it is. But this is how it works. So back to anatomy again. You have the vagina, the cervix, and then the uterus. The uterus is where the baby will live should you get pregnant. Okay, and then I mentioned that the progesterone creates a good environment in the uterus. It will thicken the. I wish you guys have seen uterus before. Oh, you guys haven't seen uterus before, eh? You guys haven't seen uterus before. So as I seated here, the uterus is like this balloon. Okay, it's like this balloon. So the inside the balloon, you call it the endometrium. That lining will become thick. There will be a lot of blood supply to the area. We call it vascularization. And then there is thick mucus that is produced to block the opening of the balloon. So once there is embryo, once there is fertilization, the baby gets a good environment to grow. When the progesterone levels begin to drop by day 28, the progesterone hormones are what, the progesterone hormone is what is holding this endometrial lining together. It's making it thick. It's helping in what we call the vascularization, more blood supply to the area, so that should you get pregnant, the place is good. The place is good to hold the pregnancy. Okay. So once progesterone level drops, what is holding the endometrial line breaks down and it comes out as blood. Do you understand? Like, do you get it? Do you get it? Yes. So if you see a uterus, the inside of the uterus, it has like vessels, plenty of vessels running through it, a lot of vessels. It becomes thick, so that once there is embryo, good. Oh, you are very resourceful. So this is the vagina, okay? This is the cervix. So this is where, in the event where there is high progesterone levels, there is a thick mucus plug that blocks this side. So nothing goes into the uterus. And this is the uterus, okay? This is the uterus, okay? So during ovulation, this uterus becomes very thick. There's a lot of blood supply to the area. So that once there is embryo embedded into the uterus, it gets good nutrients. Do you understand? By the 28th, progesterone levels drop. So what is holding the thickened endometrial lining is gone. And so everything breaks down and then it comes out as blood. You feel dizzy because every month you are bleeding. You are losing blood. You feel dizzy. You get what you call easy fatigability. Every little thing, like the least thing you are tired, you get what you call palpitation. Your heart is beating boom, 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 boom. So if you are anemic, if your blood level is low, you feel dizzy. You get tired easily. You experience what's called palpitation. Your heart will be beating boom, boom, boom. I'm sure that's why someone advise yourself to take the folic acid, because the folic acid helps to build your HB, it helps to build your blood level. So you menstruate, you've lost a lot of blood, you take the folic acid, and then I think every 2 weeks or every month, it increases your HB level by 1. Have I answered your question?
And that is Dr. Kofi Nate Manasseh. Oh. I have to break protocol. My facilitator just came that this question is very heavy and we have to ask it. The girl has even written it down. She menstruated for 2 weeks, and during that period it was blackish and very heavy flow. After that it came normal for about 5 days. What was the cause of her blackish flow?
So I want to understand the question. The first few days of the cycle, the blood was altered, very dark. And then after that, it became like the normal blood. So it means she bled for almost like for more than 10 days. And this happened only once. So here's the thing. Our bodies, very complex. Okay? The reason why I asked it the first time is because for a lot of time, you realize that there are times when your body behaves in a very funny way, and then it goes back to normal, which science can't even really explain. It becomes an issue of concern. Should this happen for a long time? But then again, if blood is dark, it means that the blood has stayed in your body for a longer time. And then it is altered. It becomes like an issue of concern. For instance, if you are bleeding from, let's say, your throat into your stomach, into your feces, before the blood comes out, it will be dark. And so it tells me that, oh, this bleeding that is dark is coming from your upper part of the body and not your lower part of the body. Because if it's lower, the blood should be bright red. But this is the first time it has happened. I don't know when. I don't know if it's recent or it's happened like months ago and everything's back to normal. If not, then I would say there's no cause for alarm. Unless, of course, it's like a recent thing, like it happened just this past month. Then I should be worried. But if that's happened already and it's back to normal, then we are good. I won't say we are good, but there's really no cause for alarm. Yeah.
Very well. A round of applause, ladies and gentlemen. A round of applause. People are seated right in front of me. They are not minding me. With everything that Doc has said, even though she also has a presentation, I'm looking at Reverend Accra because those days when I was here, and then you hear all these questions that you people are asking, and you know, you heard Doc saying that you'll be having palpitations, you are weak, you are dizzy. Reverend Accra will tell you, are you a witch? Why are you menstruating and not eating well? Are they witches? You are losing blood every time, and you are not eating well. Some of you will consciously starve yourselves. You know, you are not witches, are you? I'm not the one saying this, Reverend Accra. Alright, let's invite Esther. Esther is a Nimeli too. She has a presentation coming up. But then she just wants to tell you something briefly. DJ is standing by. We'll go on a quick commercial break and dance a little, and then we'll continue. Are you excited? Yeah. A lot of information for you, right? Okay, yes, over to you, Esther. And oh, I taught her too.
Alright, good morning everyone. So during the presentation and then asking of questions, I jotted some few things down that I would like to share with everyone. I realized that the questions that were coming up were, you know, like in the same pattern, it's all about the same thing. So I realized that, you know, there are a lot of factors that affect our menstruation as women, as girls, as ladies. There are a lot of factors that affect us. And these factors can alter how you menstruate. You know, some people were saying they can menstruate twice a month and all that. And some people too were saying it comes just 3 days, 2 days and it stops. And somebody also said she has not even started her menstruation. So there are a lot of factors that affect how our blood flows or how our system works. And one of the major factors is our hormones. You know, Doc talked about the hormones that help with the menstrual cycle. If these hormones are altered, and you know it all starts from the brain, the hypothalamus. If this organ is altered, the ability for these hormones to be released for menstruation to begin becomes very difficult. So assuming you stress yourself so much, you don't eat well, you don't eat well, you stress yourself so much, it will put a lot of burden on the brain. It will put a lot of burden on the hormones for them to be released for the medicines to start. Sometimes you may not even, it's not even time for you to start your menstruation, but then it comes. There are factors like physical activity, too much exertion on your body. It can even cause the bleeding to flow. And sometimes what we eat, as ladies, some of us like sweets so much. Sometimes you will realize that it's not even time. You take in a lot of sweet and then the blood starts coming, right? So we have to look at what we eat. Stress, we have to avoid or reduce stress as much as possible. And then we have to take good care of ourselves. And with the lady that said 18 years, she hasn't still menstruated. You know, sometimes we have certain medical conditions as women that prevent us from menstruating at all. So I would advise that this lady seeks medical condition, seeks a medical advice, yes, for her to be looked at, because it could be as a result of a lot of factors. Yes, that's all that I have for now.
Thank you very much. A round of applause, girls. Those at the back, I can't see you. A round of those in the inner corner, I can't see what you're doing. A round of applause, girls. Everybody, let's give it up. Let's give it up. Let's give it up. Let's give it up. Yay, 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 yay. So we've been seated for more than an hour. We have to go for a quick commercial break. DJ will do that. Don't sit down and be so quiet and be looking at us. Don't wait to dance. I took my dancing lesson. I'm here with one of the lecturers from Biala Flighter College of Education, Miss Gertrude Esuma. She doesn't know how to dance. Gertrude, let them see you. And when we do. But she went for dancing lessons. We all took our dancing lessons. And so are you ready? Let's get standing. DJ, are you ready to go? Let's get standing, ladies and gentlemen. It is the biology of the Girl Child Summit. Currently, we are live on the campus of Ada Senior High School. Our chairperson, Dr. Unisofe Sibe, is on floor. The headmistress herself, Mrs. Obayatan, and all the team. We are ready. To let it all down. We have an exciting moment. We are enjoying every bit of it. Yes, those who are sleeping and then snoring, stop. We are lovely informed that you had a very stressful week. We're having sporting activities left, right, and center. We share in your stress, yes, but then we are here to have all the fun. Is that okay? Put inside your bag, and then who is a classy lady? The fact that we are all here, we have breasts, we have bottoms, we have wide heads. Does that make us classy ladies? So we're going to beautiful, you answered it. So we're going to have facilitators take us through all of that. So VP, I will need you here. All right. So for classy lady, we are having Miss Gertrude Esuma, a lecturer from Biala Flighter College of Education, all the way from the Western North region. Yes, she's an educator teaching teachers how to teach. Good. And then we have Miss Eunice Kwashi, a banker by profession. Yes, a banker by profession. She has another presentation she'll be sharing with you in a bit. So, Mommy, you please, VP will guide you where you are going to. Then we have Miss Bennett Edute. Yes, Miss Bennett Edute. She will be in charge of vaginal hygiene. So the group going to be listening to vaginal hygiene. Please come this way. Yes, she will handle that aspect. Then we have what is in a lady's bag by Miss Anita Jumper. Yes, which group is having Miss Anita? Which group? You. Don't worry. Okay, fine. They've already said that. Again, which group is left? We can have another classy lady. Those are the inner room. Those are the inner room. Yes. Great, great. Those in the inner room, Faith, please get them here for me. Their presenters should be here, quickly, 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 quickly. Good. Vaginal hygiene. Yes. -5. Vaginal hygiene, -5. Nifeli. Your mouth are busy, right? So you are able to say ago. Nifeli. Nifeli. Good. So when we've gotten was the highlight of your discussion. So you mentioned your name, you mentioned the name of your facilitator. If, of course, if you get it wrong, -5. If you get the name of your facilitator wrong, -5. So if you need to rush and get an information within the next 30 seconds, you can do that and come back quickly. Fortunately, the facilitators are missing, and so you see where you get. Beautiful. So we will first listen to classy lady. So 1 minute. Just 1 minute. So the preamble is that you mention your name, you let us know your facilitator, and then you tell us that one thing that was striking out for you. That one thing that after so many months, so many days when we are out of here, you will always remember that one. That is what we would want you to share with us. Under 1 minute. All right.
My name is Hadassa Al-Hassan. And the name of our facilitator is Miss Gertrude Esuman. We spoke about classy lady and we talked about the definition and how to be a classy lady.
So how will one be classified as a classy lady?
Okay, classy lady is not about dressing, but it is how we respect ourselves and others and consider how we respect them. Classiness is about having self-respect, boundaries, and discretion.
Very well. Let's clap for them. Good. Now you can take your seat. We will come back for the mother cards that you have. Another classy lady group. You are also classy lady. Please come up here. Good. So that we can get them. Wonderful. Let's go.
Okay. My name is Hilda Ofwe.
Face them. Good.
My name is Hilda Ofwe. And today we talk about classy lady. And a classy lady.
Your facilitator.
Okay. Eunice. Madam Eunice Kwashi. Kwashi. A classy lady is a lady who has values, character, appears in a good and decent manner. And some features of a classy lady are character and values, appear decent, speech and communication, social behavior and etiquette, and some misconceptions about classy lady. People think classy ladies are supposed to dress in expensive clothes, but that's not true. And the second one is, people think classy ladies are those that put on nails, makeups, and so on and so forth. Thank you.
Thank you very much. Classy lady, are we done? We've exhausted classy lady. Then please you can sit down. Which group do we have? Who was the facilitator?
Mrs. Alison Ferguson Brinkwan.
Beautiful.
Okay, so we learned about some ways that a classy lady.
Your name. Your name.
Please, I'm Gloria Tete. Okay. Some ways a classy lady has to use when talking in public, or some polite words you have to use. We have words like excuse me. Let's assume you are going somewhere and there are lots of people on your way. You have to say excuse me for them to pave way for you. And we learned about no thanks. Maybe someone is offering you a gift and you don't want it. You don't have to say, please, I don't want it. You have to use the word no thanks. And we also learned that you have to know how to say pardon me. Let's assume someone is talking and you didn't hear. You didn't have to say or hey. You have to use words like pardon me or please your pardon. Thank you.
Thank you very much. Beautiful.
I'm Nakom Precious Lumoki.
And then your facilitator?
Mr. John Bright Agbashi.
Okay.
Okay, so I'm here to present to you all about oral hygiene. And the definition of oral hygiene is how to take care of your teeth and the things within your mouth. So some items that we used to take off our teeth are toothbrush, toothpaste, and floss, and mouthwash. So I'm come to teach you how to brush your teeth.
1 minute.
Okay, so most of us make mistakes when brushing our teeth. We are not supposed to brush like this. When you brush like this, we tear the gums. Okay, that's what causes bleeding sometimes. You are supposed to brush up and down like this. Can you see? Yeah, you're supposed to brush like this. And in using the floss we use the floss to like remove particles within our teeth. And we use the
1 minute.
And we use the mouthwash to rinse our mouth to give the mouth sense, good sense. Okay.
Thank you. Thank you. The facilitator is a speaker. He will come and speak to all of us in a bit. Okay, so vaginal hygiene, menstrual hygiene. 1 minute. Who is the other one?
My name is Deborah Banaman, and our facilitator is Dr. Eunice Osei Asibi. When we talk about menstrual hygiene is the good practice of hygiene when we are in our menstrual periods. This is talking about as a lady or a girl. Some of the practice you have to equip when you are in your menstrual periods. And the proper way of practicing menstrual hygiene is 1. Changing of pads regularly, at least every 4 hours. As a young girl, if you are in your menstrual cycle, you have to change your pads regularly, especially for those that flows heavily. Because if you flow heavy, the pad, when it's full, you have to change it. Otherwise, if you don't change it, you can spoil yourself. So at least change your pads at least 4 hours.
Thank you. Are you not done? 1 minute. I give you 1 minute. 10 seconds.
And secondly, bath regularly. If you are a girl and you are menstruating and you don't bath, you know blood really stinks. It smells. If you are menstruating and you don't bath, it gives you scent. Especially when you are menstruating and you don't also shave, the blood also contains bacteria, which can also cause another infection. Thank you.
I love what you mentioned, bacteria. We don't have bacteria. So it's always either you are mentioning the singular form as bacterial or the plural form as what? Bacteria. Are you a science student? Business student. Give it up for her. Give it up for her. Good, good. Yes, indeed. Dr. Sibelius Luke. Yeah. All right. Who do we have?
What's in a lady's bag?
What's in a lady's bag? Your presenter was?
Ladies and.
Beautiful. Let's go.
Okay. So some of the things we can find in a lady's bag is we have tissue, sanitizers, comb, lip gloss, perfume.
Lip gloss. Let's all go.
Lip gloss.
Gloss. Let's go. Lip gloss.
Lip gloss.
Right. Let's go.
Perfume.
Keep quiet.
Mobile phones. Now, these things in our bag helps us it boosts our confidence and our personality. We as ladies, some ladies have the lip gloss in their bag. As Miss Anne said, she said when she uses the lip gloss, it boosts her personality. She's able to have confidence and then talk wherever she finds herself. And then the comb is supposed to be in our bag, we as ladies, so that when sometimes we don't have a good hair. Some people have hairs that are like a hand, so you use them whenever your hands are like that.
1 minute.
The reason why we have these items, or why these items matter in our bag, is that it shows our fashion and our function. Yes. The meaning of the function and the fashion is that where you are going determines what you put in your bag. Some people, when they are going to funeral, they keep small bags. Some use big bags. And then these small bags can keep like your sanitary bags, your like those things inside. So you take a bigger one so that it can contain all those things inside, so that you won't embarrass yourself in public. Thank you.
So a quick one, you are supposed to have one in your bag with everything we said. They mentioned sanitary pads and then the tissue. The sanitary pad, even we that are old as we are, we don't just get up and travel. You can have your floor at any time. So you make sure, no matter the time, you are going for classes, you have lectures, you put a sanitary pad inside your bag. You don't go about littering the whole space with your used sanitary pad. Doesn't it look disgusting? Then you finish and then you leave it anyhow. Where do you come from? Good. So please, you don't leave them anyhow. Do we understand ourselves? Yes. What are you supposed to use to wrap it up? Very well. You're supposed to have some graphic papers with you. Even the wrapper itself. A speaker is coming, she's going to take you through how to wrap it nicely. You fold it nicely, and then you discard it. And those of you have been putting it in the closet. Is that a good thing? No. All right, let's clap for them. Which group is this? What do we have? Vaginal hygiene. Who was your presenter?
Madam Benesadite.
Let's go.
My name is Annabelle Jackson, and we learned about vaginal hygiene. And vaginal hygiene is all about keeping the vagina clean. And also learned that the vagina is already clean because it has a bacteria that keeps it clean, and the bacteria is called normal flora. And as a girl, we have 3 holes. The first one is where we urinate from. The second one, we menstruate through the second hole. And the third hole, excuse my language, is where we defecate through. And ways of keeping the vagina clean. First, as a girl, I'm supposed to shower twice a day. When we are showering, you have to use lukewarm water to wash your vagina. You're not supposed to use any form of antiseptic to wash your vagina because the antiseptic contains chemicals which, when comes in contact with the bacteria, it will react. Yes. And also, we also learned that after urinating, you're supposed to use a tissue to pat the vagina dry. The vagina is not supposed to be wet or moist because it will create room for the bacteria to grow. And if you are patting the vagina dry, you don't use your fingertips. You use the surface of your fingers. That's how you pat the vagina dry. And also, this one is not now. Like when we get married in the future, after sex, you have to urinate because the urine contains some chemicals which irrigate the vagina. Yes.
Did you hear what she said? This is not for you now. When we get to class lady, we'll talk about it. You close your ties. Good.
And also, we are not supposed to wear nylon or polyester panties and underwear. We are supposed to wear cotton panties because they don't trap heat. And
1 minute.
I'm not supposed to wear tight undies.
Okay.
Thank you.
Thank you. Who do we so much? So who was your facilitator?
Madam Philippa Boati.
Okay.
So we are going to talk about oral hygiene. So when we say oral hygiene, it is the practice of keeping the mouth, teeth and gum clean and healthy. So when I say bright smile, you say healthy life. So bright smile, healthy life. I can't hear you. Bright smile, healthy life. Okay, so these are some of the importance of oral hygiene. So it makes us confident. It prevents tooth decay. Okay, so you should always brush your teeth 2 times daily.
Thank you so much. Well done. The final group standing. Angela Edutai, kindly meet your sister Bernice Edutai outside right now. 30 seconds and come back. The last group standing. What are you giving us?
We are talking about vaginal hygiene. Okay, so our facilitator was Madam Esther Yobe, and she first discussed with us the meaning of vaginal hygiene. And we said the meaning of vaginal hygiene means that the keeping of the vagina and its surrounding clean to prevent infections. So we also talked about some things that we do that leads to vaginal infection. So my friend will continue.
1 minute. Things that we do that leads to vaginal infection. 1 is douching. Douching refers to the usage of soap to wash the vagina, which is very bad. Then secondly, we have improper cleaning of the vagina improper cleaning of the anus after visiting the toilet. That is, and the best way of cleaning the anus is from the front to the back. That is, cleaning from the vagina to where the feces came out from.
That's the aim.
Then thirdly, we have the wearing of tight undies and panties. Lastly, we have to avoid the cleaning the vagina after bathing. We have to use clean water and not with any other detergents. Thank you.
Are we supposed to put garlic in the vagina?
No, please.
Are we supposed to be putting our hands inside the
No,
vagina?
please. No,
How are you
please.
supposed to wash the vaginal opening?
You just have to wash the surface with a clean water.
Just the surface. You see where the clitoris is? You just wash it nicely without dipping your hand in there. You have no business bringing anything out. Do you understand? Hello? Nimeli? Thank you. The final one, oral hygiene.
Our representative for the topic oral hygiene is Miss Mary Bojote. And she took us through the topic oral hygiene. Here we learned the definition for oral hygiene. Oral hygiene can be defined as the process of taking a very good care of your mouth in order to prevent mouth odor. We also looked at ways to take care of the mouth. It's by brushing your teeth twice daily. Brush your tongue after and before meals. Reduce the use of toothpaste. Changing your toothbrush at least every month. Visit the dentist at least twice a month. These processes will help us.
Twice a what?
Twice a month.
Twice what?
A month.
You see. A man. Let's go pronounce it.
A month.
Man.
A month.
C-H, how do you pronounce it? Let's go, man.
Man.
Clear your throat. I want to hear it. Man.
So take a very good care of our mouth. And she also took us through ways to strengthen our teeth and mouth. Apart from brushing your teeth daily, you should also eat more food, especially fruits and vegetables. Avoid too much sweets. Taking foods that contain calcium, like soft bones, into brackets, biscuits,
1 minute.
And we can also prevent the mouth from bad odor by using lime and charcoal.
Thank you very much. A resounding round of applause. Thank you so much. We are now coming to listen to the experts' advice on everything that they've told us in the next 20 minutes. We are going to listen to the experts' advice. So what is in a lady's bag? To help us do justice to it is the banker among us, Miss Eunice Kwashi. Wherever she is, let's welcome her staff. Oh, let's do it. Watch it up. Good. What is in a lady's bag? She's coming with a bag. Can you see that? Great. That's okay, DJ. Thank you.
Good afternoon to you all. Yeah. a pleasure being here, and I'm glad to be here with all of you. Within the next 20 minutes, let's pay attention and make sure we pick at least one thing that will carry through life. All right? So my name is Eunice Kwashi. I'm currently a banker by profession, and I was taught by Mrs. Fortune, about almost 14 to 15 years ago at Ibrigel Senior High School, where she came to do her internship. Yeah, she taught me biology, and I enjoyed her class very much, and we've been friends up to now. Yes, so that's the big background. So today we are going to talk we are going to talk about a lady's handbag. A lady's handbag. And how many of us have bags here? Okay, can you tell me one thing you have in your bag? Okay, those in front. Those in front will answer my question. So next time when you come to a program, make sure you get to the front row. What's in your bag? Young lady, what's in your bag? You're having a bag. What? Comb. Oh, okay. What's in your bag? Pardon? No. Comb. No, that lady was saying something. You have sanitary pad in your bag. Okay, what else? Sanitizer in your bag. Okay. Can you guess what I have in my bag? Yeah. Okay. Tell me. My phone. Okay. Oh. This is what I have in my bag. And paper. Well. Water. Interesting. A pencil. Okay. My phone. Okay. A pad. Okay. Football. Ball. Tennis ball. Okay. And then. Okay. What else? I'm sure you want to know what this is. But it has medicine in it. Tablets in it. Okay. Okay. Then I have my charger. Okay. There are other things too in it, but this is what I have in my bag. Will you consider me as a lady or not? Okay, how many of you think I'm a lady? Looking at the things I've removed from my handbag. If you think I'm a lady, raise your hand. Okay. If you think I'm not a lady, raise your hand. And so most of you think I'm not a lady. Okay. So as we go on, we'll get to know if I'm really a lady or not. Okay. So basically, in a lady's bag, a bag is an essential thing we carry every day in our life. Whether you're a student, a worker, or a mother, then you carry a bag. And whatever you carry in the bag defines you. Whatever you carry in the bag, or whatever bag you carry, says something about you. If you see someone with a backpack, you know a backpack? Yeah. What does it tell you about the person? Yes, the person is a student. If you see someone with a bag like mine, what will it tell you? Yes, a lady, maybe someone who is working. If you see someone with a gym bag, you know some people when they are going to the gym to exercise, they have this bag, they put their clothes inside. If you see someone holding that, it will tell you something about the person, right? If you see a woman with a big bag, with feeding bottles and the rest inside, yes. Yes, a lactating mother. So the bag you carry says a lot about you. And we know as ladies, a lady is not head, but is a lady is not head, but a lady is what? Yes, a lady is seen. A lady is seen. So by your appearance and the bag you carry and the things in it, it helps determine what kind of lady you are, whether you are a classy lady or not. So basically, as a lady, in your bag you must have daily essentials you need. There are some basic things that as a lady you must have in your bag. Amongst all these things I picked from my bag, which ones do you think at your stage is essential that you must have in your bag? Okay, I heard pad. Pad. So does that mean we have, our cycle is 28 days and we menstruate 5 days? Does that mean all the days of the week we should have a pad in our bag? Yeah. Okay, so a pad is one of the essentials. What other thing? Tissue. I didn't have tissue in my bag, so I'm unprepared as a lady. What else? Yes, hand sanitizer. As a lady, you must have hand sanitizer, because as we go around, we shake people, we touch things and the rest. So our hands must be clean all the time. And our fellow men, we shake them, right? Our boys, or they touch things and we go and touch them. How many of you know how they wee? How the boys wee? They go and, so just imagine he didn't wash his hand afterwards and then you go and touch his hand. Yes. So make sure you have a sanitizer and then keep sanitizing your hand. Okay, so we know some of the essentials. We should have a sanitary pad, we should have tissue, we should have hand sanitizer, and then what else? A comb. A comb, okay. And mirror, you don't really need a mirror. So just essential thing, because the bag is a small package where you keep things. You can't keep the whole world in it. Okay, and as a young girl, it's also good to track your cycle, because maybe it's not everywhere or every day you are carrying a big bag that you can put a sanitary pad inside. So you just make sure around getting to the time where your menses is about to begin, you have your sanitary pad by you always. You can keep it any other day, so that maybe a friend may be in need, she forgot to take hers, and then you can assist. Alright? Yeah, so as a classy lady, you should keep these essential things into your handbag, in your handbag. And one may ask, the kind of bag you hold, is it big for fashion or for a function? Are you looking for fashion, like it's classy, so I'm using it? Or, and this bag can carry all my books, so that's why I'm using it. Which of them? Okay, those who say function, hands up. Function. That this bag can carry my books, so yes, that's what I'm using. Then someone will say, no, this bag is too funny. How can I keep this big bag at my back? Fine girl like me, lady like me, how can I keep this big bag? No. So how many of you say function? Function. Okay. How many of you say fashion? Fashion. Oh, okay, a few people. Okay. So generally, it depends on the occasion. It depends on the occasion, and it's a blend. So at this stage, as you are in school, I will say function. Function. Because you are students. What's your core mandate? What is your core mandate? Yes, to study. So anything that will help you study, that is what you should do. That should be your focus now. As a young lady, you must have a focus and then a purpose. And every day of your life, every decision you take, every step you make must be towards reaching that goal. So at your stage, anytime I'm going somewhere, I have a pen. You see, even now I have a pencil in my bag. That says something about me, that I like to study. So I always have a pen, pencil, and at least a notebook in my bag. So as students, make sure you have a pen or a pencil or a notebook always by you in a bag. Have you heard the saying that the lightest ink is sharper than the smartest brain? Yes, yes. So always have a pen handy. I know some of you are taking notes, some of you are not taking notes, but it is very helpful. You may say you remember, but you forget. So always write something down. Oh, yes. So as at now, I said our choice of bag should be for function. And then as we go about Sunday, of course, Sunday when you are going to church, would you wear your backpack to church? No. Yes. So with that, you can put a little bit of fashion in it and just carry a small handbag with the basic essential things in it, right? So there is no clear-cut rule. It depends on the occasion and it depends on the purpose. You may have to use function or go by fashion. Maybe you are going for a dinner or a party. You go with fashion. But with all that, make sure that as a lady, you have those basic essential items in there. Alright? So as a lady, our basic essential items are what? Tissue, pad, sanitizer, and then a comb. Yes. Alright. And then as we go on, so what are some cultural and social expectations about ladies? What do people expect you to have in your bag as a lady or as a woman? Yes, someone said money. Yes, we expect you to have money. Pardon? Handkerchief, yes. Now most of us don't use handkerchief, we use tissue. And if you are keeping a handkerchief, make sure you keep a neat one. Some of us will use the same handkerchief. Today we fold it like this, and then you see it. Then tomorrow we'll fold it, and then show the neat parts, and then use it. No, it contains a lot of germs. So make sure you change your handkerchief. Is very easy to wash. So make sure you always change it and use a clean handkerchief. And society expects women to be ready all the time. Society expects ladies to be ready all the time. If you are in a class and let's say someone even wants a spoon, do they usually ask a man or a woman? Yes, they usually ask a lady. So as a lady, you have to be prepared all the time. You have to be prepared all the time. That's why we are advised to have these basic essentials in our bag. Alright? Okay. And our bag is our privacy. Our bag is our privacy. How many of you feel uncomfortable when someone goes into your bag? Yes, because we have a lot of important things in our bag. So our bag is our privacy. Yes, and as young girls growing up, let's compare our handbag into a virtual handbag we have as a human being. We know life is a journey, right? If you are going through a journey, you go with your luggage, a bag, so that whatever you need along the way as you go is in the bag. So as young girls, as we are growing up, let's make sure we fill our bags with essential things. For example, let's fill our bags with big dreams and not doubts, with positivity and energy and not laziness, so that as you go along in life, nothing will deter you. Fill your bag with enthusiasm, positivity, dreams, and then efforts. And then remove all negative things from your bag. And then one other thing you do is that you declutch your bag regularly. You know, as I started removing the things from my bag, I removed this. rubbish. I'm not using it for anything, but it's in my bag. If you go through your bags right now, some of you may have things like toffee wrappers, biscuit wrappers in your bags that you've forgotten about. Yes, so make sure you declutch your bag regularly. And also your life, the life bag you are carrying along. Once a while, sit down and relax and look into your bag, look within you. What are some of the negative things I'm doing that will not help me? And take them out of your bag. And leave only positive and good things in your bag that will help you along the way. All right? Yes. So make sure you maintain a bag with all the essentials and then all the positive energy you need to help you in your life. Thank you very much.
20 minutes. Yes. Okay. We'll be finishing up in no time.
Good afternoon. I'd like to say a big thank you to the summit head, Madam Fortune, and our facilitators. God bless you for coming. I would like to go straight to the point because of time. Jack, where are you? I believe you are here. Are we all here? Glory to God. You see, we all want to be here, but it takes a lot of work. Are we together? Most times, when you ask people, where are you going? They'll say, I'm going to. There are accounts who say, Bibiamu is a sin. And then they always say, Adu Hope. And then you will also say where they removed it. Please, we don't remove it. Extraction or removal of it is always the last resort. When there is nothing else, then we take it out. Are we together? So when you are coming to us, there are so many things we do. We just consultation and education, just like we doing scaling and polishing, that we clean them up and then fill it when there's a hole and it's not at the point where you have to take it out. You can fill it, restore functions, and the person will use the teeth normally. And then extraction of the tooth, a root canal. That is if we are to remove the tooth, but you have money. Let me put it that way. The tooth is spoiled. We have to take it out. But this is another option. If you don't want it to go, we can do a root canal for you. And then we do whitening too. I don't think I'll talk about that. Then you can replace the tooth. If after extraction, when the tooth is gone, there are other opportunity for you to replace it. Either with dentures, which can be removed, or crowns that are fixed. And then we have braces, aligners. So you can see, these are some of the reasons you need braces for this kind of malnutrition. If these things happen, it's not your fault. It could be because you were born with jaw challenges, or your parents, you inherited some of this stuff from your parents. Let's go. And if it's gone, there's still hope for you. We can replace it. Are we together? So this particular one, I know a lot of my colleagues here, some of you, fractures. When it's broken, you come, we can build it up for you. You get your confidence back, you are good to go. Yes, this is where a lot of us are victims. So these are calculus. Maybe later on I'll mention that. Calculus, that is plaques, dental plaques after eating. You see a lot of people using sticks to pick some white stuff around their teeth. When they become hard, because of that. Maybe they are going to have, they hide in intervals or spaces between your teeth and the gum. Then at the long run, all the other surfaces of the teeth stick to your teeth. Bacteria in your mouth. When the doctor was mentioning, he talked about normal flora. It's there always, but when the pathogenics are also, have this, then Christmas. With this, you have problem with your teeth, you have problem with your gums, but there's hope. We can remove it, and then we go. If the tooth is gone, still there are other sources we can replace it. So let's go. Now, what is health? If you say I'm healthy, what do you see? What are you saying? Most times, especially we students, because I'm still speaking, when you have problem with your teeth, you are not sick. It's only when you have problem with your stomach and other parts of the body that you say you are sick. But this is the WHO definition of health. It says that a complete physical, mental, and social well-being of a person, and not merely the absence of disease. So, if from head to toe, a little portion of it, sometimes even from head to toe is okay, but your mom hasn't sent you any questions this week, and you begin to feel some ways. So let's go to optimal oral health. When we say your oral hygiene is good, your mouth is in good condition, optimal, at its highest level. All we are saying is that you can use that mouth to eat, drink, talk to how do you say, when you talk to your colleagues or you socialize, they don't feel any form of embarrassment. So pain, you yourself, no pain, and when you talk to others, they are not embarrassed. Your mouth is in good condition. Are we together? So there are different conditions. Dental caries, periodontal disease, cancers, birth defects, injuries. When you are a confident lady, everything is in order. But you join Okada without helmet, very soon your front teeth will disappear, and that confidence will no longer be there. Are we together? So anytime you join Okada, tell them they should give the helmet to you. If anything happens, you are safe. Are you together? Okay. So this is a tooth decay or dental chaos. If you see this tooth here, it's divided into layers. The first, which is the enamel, dentine, and so let me get close. You can see this layer, and this layer. Basically, this and this are the same, and then this, and then this. Okay, so let's go. Just take note of that. What do we use our teeth for? What do you use our teeth for? Okay, so I know you've seen this, so tell me what is not here. What do we use our teeth for? So, even God is so, I don't want to do that. But kids needs their teeth in place to be able to learn how to pronounce words. So, adults also need teeth. We need it to speak, we need it to talk. So for speech, eating, no matter what is in the food they prepare, if your teeth, you can't use them to eat, to break them down. We say that digestion of carbohydrates starts from, so if you can't break it down, so you eat it, you swallow it, it will just go. If it's not digested, you have no nutrient. So you need it. Facial structure and appearance. You see our grandparents, within a short period, most of our grandparents, you can attest that when you talk to them, their face just falling, wrinkles. It's because the teeth that are supposed to block or give them the alignment, proper structure of the face is gone. So the cheek begin to fall inside. Aesthetics for beauty. I think when I was doing the presentation, I saw one of the girls I told me she has so a very nice dentition. Let's go. Why do we have tooth decay? Why you have tooth decay? And I think this is one of the best audience to know this. Because most of, in our schools, most of our breakfast, in all have refined sugars. So when you eat, maybe this morning, rice water with sugar and bread. The bread has sugar, rice water has sugar. So sugar in your meals. Susceptible tooth. You see the tooth? The teeth are not in any proper alignment. And so they've created an avenue for bacteria to align themselves, feed, release their byproduct and cause harm. So the bacteria itself in our mouth, we all have it. Then time. So if you have taken your breakfast in the morning, evening time, you are going to bed without brushing, by the following morning, you are giving the bacteria opportunity to start to decay. They only need 20 minutes to start their work. The advantage therefore is that during the day, as I speak, I talk, I drink, we displace them because they need to stay at a particular place for a period of time. So once we talk, do all these things, you displace them. So at all times, they have to start afresh. Maybe that is why we don't have to decay. But most times, before you see a hole or a cavity in anybody's mouth, that actually has gone on off for at least 2 years. So your ice cream, your Fanta, your Coke, if you take it, just get water to rinse your mouth immediately. Stages of tooth decay. So you see the first point is just in the first layer. At this point you hear people say, oh, I have a hole in my mouth, in my teeth, but it's not paining me, no problem. And at this point, because there are no nerves in the enamel, so you don't have any challenges. Then the second one, we have nerve tubules. And so you, at this point, you begin to feel sensitivity. When you drink chilled water, like a shot baby gets there, you feel pain. You can take medicine, it will stop. It can also stop without medicine. Then, the third stage. When it gets to the third chamber, pulp chamber, there's nothing you can do about that. Infection started. If the only thing you need to do at this point is to come to the hospital. No amount of herbal medication or whatever can help you. Just come to the clinic, and this is where we do root canal treatment. All the first 2 stages, we can do different kind of filling for you. Glass and normal composites, and you can still use your teeth normal. Nobody will even know that you've ever had tooth decay. The third one, that's the swelling started, that's an abscess. So swelling started within the bone. Then, because the bone is a hard tissue, you won't feel any swelling. It moves from there to your cheek, the cheek begins to swell, and then if nothing is done, it moves from this side to your throat. If nothing is still done, you join God in heaven. Let's move. So these are not they are not in any order, any specific order, but you can see. So this is an abscess. It's a swollen tube. Once you get here, just know that your condition is serious. Don't be roaming about using don't do self-medication. Just come to the hospital. From here to Faith Corporate, you can only walk, but just don't walk. So, pain, discomfort. When you have tooth decay, your jaw will swell. Mobility, tooth mobility. Most times, the tooth will not be shaking, but the tooth will not be shaking. A hole will be in the tooth. But some other times, the tooth will be mobile. It will start shaking because the gums are involved or are affected. The gums will become loose, then bleeding. This is even the first stage of it. The first stages, that's gingivitis. When you begin to have bleeding gums, when you brush or when you bite on apples or any, then you have bad breath. You have your tooth lost. You can't eat proper. You begin to look old, obviously. If you have serious dental issues you don't handle, you die. I just have to say it. Tooth decay or tooth dental care skills. So treatment. You see, visit dental clinic. Visit dental clinic. You don't treat any form of tooth decay in the house. So brush morning, evening, especially in the evening. Very, very, very important in the evenings. Use dental floss. So if this is your teeth, floss, put the floss in between your teeth, scrap it on the tooth surface, on this tooth surface, pull the content out, you are good to go. Okay, so that is it. In between, on this, you pull it out. So it's like this. You are good to go. The previous one. Okay, so the sugar, I think I've spoken about that. Take your fruits and vegetables. And then check out every 6 months. Every 6 months. Use fluoride. Avoid using your teeth to open bottle tops. And then change your toothbrush at least every 3 months. And then let's go. This one I know at that school, you don't do this one. Alright. Thank you very much.
Please, my name is Adita Ibenjamin. Please, if in the first stage of tooth decay, is it a way you yourself can prevent it?
If you have anything to do, then the first stage will not even happen. You have to brush to prevent a hole or a cavity from developing. So once the cavity develops, there's nothing you can do. Most times when you clean it properly or when you begin to clean, when it's not too deep, the tooth itself can re-mineralize itself, but it's very scarce. Thank you. Just a minute.
Okay.
A minute.
A minute.
About brushing. The lady who presented for oral hygiene did something and I just so it is not up, it's not actually up and down. Okay, just for 1 minute. Sorry.
She's going to help her.
So it's not up and down. I said in the first stage, avoid brushing this horizontal. It causes abrasion. Get to the next one and show. So you see, if you brush horizontally, it will cause abrasion. So it's up and down, but it's not like this. The top one, brush it down. The down, brush it up. You put your teeth together and then you go circular. All this process, gums shouldn't be involved. Don't touch your gums when you brush. Thank you.
Thank you very much. A round of applause. Let's do that. The problems we have with you girls. All right, you take that with 20 minutes.
All right, good afternoon, everyone. So I'll be taking you through menstrual hygiene. By the term menstrual hygiene. So when we say menstrual hygiene involves changing menstrual products. The products are the pads, tampons, reusable pads, and the caps. So I have pictures on display that we'll go through as well. So menstrual hygiene involves changing menstrual products, which are the pads, the tampons, and the caps regularly, and then keeping the genital area clean with mild soap and water. Washing hands before and after handling products, and wearing clean, breathable clothing. Proper disposal of used products is also crucial, as they should not be flushed down the toilet, but wrapped and put in a bin. So when we say menstrual hygiene, it involves how you keep the vagina clean, how you change your pad, how you dispose the pad after using, what you do before and after disposing or wearing the pad. And it also involves the clothing you wear, the underwears and the panties. They all come, or they all form the menstrual hygiene. So now we have some certain cultural myths and taboos that our forefathers, they believe in, that when someone is menstruating, this and this, what they perceive about women or ladies or girls when they are menstruating. So under that, we are going to look at the taboos and how these taboos and myths affect our daily lives as women or ladies. So the first one we are going to look at, I hope when I say taboos you understand. Yes. Good. So the first one we are going to look at is menstruating girls or women are unclean. That's what they believe in the olden days. But now those things are not there anymore. I know in some places they still practice that, but we shouldn't let them say that about us. We should stand firm as women and ladies. So what they believe is that menstrual blood is impure, and they can lead, which may lead to avoiding physical contact with menstrual women. So in the olden days, they believe that when you are menstruating, or when a woman is menstruating, that woman is not clean, or the woman has a lot of impurities. So they will not even get close to you. They will not even talk to you for a while until you are done menstruating. They will not even let you touch their food. That's one of the beliefs. And then the next belief is menstruating girls should not enter shrines or participate in religious activities. And what they believe is that when you are menstruating and then you enter a shrine or a religious place, something will happen to you. And if it doesn't happen to you, it will happen to your families, your loved ones, and your extended family. That's what they believe in. But today, that thing is not there. I know some places they practice that, but it's not scientifically proven. When you are menstruating, you can go to any place as a woman, as a lady, as a girl. You can go anywhere and nothing bad will happen to you, okay? Then the next one on the list is menstruating women should not cook certain foods. So in the olden days, they believe that if you are menstruating and then you cook, the food will not taste good, and then the food may spoil. When they eat the food, something will happen to them. And most of the time, this belief is the men, it's the old men, that they believe in such beliefs that when you are menstruating, when you cook, it won't taste well and all that. But we are here to advocate that all these beliefs, they are just taboos, they are myths, they are just hearsays, okay? They are not true. When you are menstruating, you can cook, you can work, you can do anything that you want, except for certain people that when they are menstruating, they find it very difficult even to walk with their barefoot on the floor, except for them. But aside that, we can do anything when we are menstruating. Okay, so let's look at the next one. A girl should not cross water bodies while menstruating. So these are some of them. Please, can we go on? Okay. Menstrual girls should not engage in sports or physical activity, and they believe that when you are menstruating and then you involve in yourself in such vigorous activity, that you may have a lot of menstrual cramps, and then you may not be able to give birth in future. But it's not true. When you are menstruating, you can involve yourself in sporting activity. You can do anything actually, and nothing bad will happen to you, okay? Menstrual blood can be used for harmful spiritual purpose. This is a myth though, but there's a little truth in it. And this is what happens. If you are menstruating as a girl or a lady, you should be able to dispose your sanitary pad properly, because we have Sakawa, people who do money rituals and all that. So when you, after menstruating your pad, when you remove it and then you leave it anyhow, as for this taboo, it's still there. Yes, so when you after using your pad, you should fold it nicely, put it in a polythene bag or the rubber that comes with the pad. Fold it nicely or tie it nicely and put it in a bin. Don't leave it on the floor. When you leave it on the floor anywhere, anybody at all can come into contact with it. Anybody can take it and use it against you. It's your blood, and with your blood you don't have to let anybody see it. So I hope from now on we'll dispose our pads properly. Okay. Hey, the yes was too small. Please, are we on here? Okay. So please, let's be mindful. They also say that menstruation is a sign of sexual activity, which is not true, okay? You should not bath or wash your hair during the first days of menstruation. Here they believe that when you bath, when you are menstruating, the blood will not flow again. That's what they believe. But is it true? No. Okay. So when in future, if you find your place, if you find yourself at a certain place and you realize that people still believe in such taboos or myth, you should be an advocate for them that is not true. Nothing will happen to them if they bath or they wash their hair. Okay. Menstruation should be kept secret, and they are saying that a strong cultural expectation is that periods must be hidden, and this leads to girls feeling ashamed. So in the olden days, they believe that when you are menstruating, you shouldn't tell anybody. You should keep it a secret to yourself. But the thing is, you see, as we discussed earlier this morning, some people will be menstruating and their form of menstruation will be abnormal, bleeding more than 7 days or less than 4 days, which is abnormal to certain extent. If you don't voice it out or if you don't tell somebody about it, how would we know that you have a problem? Let's say you are bleeding for more than 10 days. You will just be walking and then you just collapse because the blood in you is almost done. So when we are menstruating and there are problems, you voice it out to our parents. Shouldn't be ashamed. Okay, this thing is designed by God. As a woman, so far as you are laying eggs, so far as every month you lay eggs, the blood will come. If you lay the eggs and no sperm enters the egg to form a baby, blood will come. It's part of us until we reach menopause where we will not be bleeding again. It's part of us. So if you have problems with it, you should let it out. You should tell your parents or anybody you trust that can help you with menstrual problems. So how do we change or how do we cancel all these myths and taboos? It's just by doing the opposite. All the taboos we talked about are not true, okay? So voice it out if you have a problem. Voice it out if you're having any challenges, or even if in future somebody tells you that, hey, you are menstruating, don't cook for me, don't do, you can tell somebody, okay? You can tell somebody. Yes, please let's move on. Please let's move on. Okay, so let's look at how, as girls or women, how these taboos in the olden days was affecting girls. You see, at the end they become timid, okay? At the end they become very shy. They are not able to tell anybody, because if you tell me that if I'm menstruating, I shouldn't go to religious places, I shouldn't cross any river, I shouldn't cook. If I'm menstruating, I will not be able to tell anybody. I'll keep it a secret, so that I'll be doing all these things they are saying we shouldn't do. Okay? So it will call us up. We don't want to be called up. That's why we are debunking all these taboos and myths, so that as women, as ladies, who will become bold in our society and will be able to empower other girls or women. Please, let's move on. Let's go. So how can communities challenge harmful cultural beliefs? So we'll start with the school before we come to the community. So as a school, we need to help each other. We need to provide dustbins around, that when we are menstruating, we'll have easy accessibility to waste bins where we can dispose them of. And then washrooms, assuming you are in class, you are menstruating, and then let's say there are no dustbins around, no proper washroom, this lady will not be able to, change her pad regularly. She will say she will wait till they close before she will go and change her pad. And even that, proper disposal of the pad becomes an issue because there are no dustbins around. Okay, they said I have a few minutes, so I will jump to how to use the pad, how to dispose it, and then we take questions, okay? Please, I have something to show you. Please, can you move on with the slide? Some images I want to show them. So please, this is a tampon. Do we all know a tampon, what a tampon is? It's also like a pad, okay? This is how we use it. You insert it into the vagina. You see this rope? When you insert it into the vagina, you leave the rope or the thread up there hanging down. So you leave it there for, let's say, 4 to 6 hours. 4 hours if you bleed heavily, and then maybe up to 6 hours before you take it out. Now the next one is the one. That's how it looks like when it gets soaked. Okay? So you change it regularly. If you can't use this pad, you can equally use the tampon. It also works perfectly well. And please, the next one. Okay, so it comes with an applicator. Instead of you to put your hand there, instead of you to use your hand to insert the tampon, this is an applicator. You open the top, put the tampon in, and then push the button. When you push, you push here, and then the tampon goes in, and you just leave it there. But if you can't use it, it's not a problem. You can equally use the other pad. Please, the next slide. Okay, so when you insert the tampon, this is how it looks like. You can see the arrow moving. So that's how the tampon will be fixed in. Okay, you are supposed to, if you are a heavy bleeder, at least 3 hours, 4 hours, you should change it so that it doesn't leak, okay? So let's look at the next slide. So this is a menstrual cup. That image, that looks like a cup. We also insert it there. What the cup does is that when you insert it, all the blood coming will pour into the cup. And it is reusable. Okay, it's reusable. All the blood will be collected into the cup. It doesn't leak. If you put it on well, it will not leak. Okay, so you insert it, all the blood coming will be poured into the cup. Then you take the cup off, you just pour the blood within the cup away, wash it, and reuse it again. But that is not a problem. If you can't use it, let's go the normal way. So when you insert the cup, this is how it looks like. Please, can we all see? That is how it will look like. And the blood coming will be poured into the cup. It will be collected into the cup. This one saves cost. Okay, you don't have to be buying pads every month. Okay. So these are, and then we have the normal pad, the one we all know. So we are going to look at how to put it on, how to dispose it, what you do before putting it on, and after putting it on, what you have to do. Okay, so we'll begin.
Right. During menstruation, how do you use your panties? Which of the type of panties do you use that is okay for you? You realize that what I have in my hand is Bible. No head on the table. No head on the table. Those in the inner room. Which type do you use for your menstruation? Do you realize that if you should use this one, look at how this is. This side. Or this side. You realize you don't feel too comfortable. But the one that can cover the whole bottle, which is very firm on you, it holds the pad in place and is able to, keep and then be absorbing the flow as it comes. Alright. It doesn't mean you wear this grandmama panties. Yeah, I agree. Now, one of the things we are getting wrong, a quick one. Remember to always use a cotton panty. What I have in my hands are not cotton panties. And you understand the biology behind wearing cotton panties to be able to absorb the sweat, right? And not be able to trap heat in there. You see this one? You've been wearing them. Hello? What is the name of this pant? Oh. Alright, now listen to this. If you tell me you've not been using it at this age, I may understand. When you grow up to a certain level, there are some of the dresses that when you wear, you have to wear this pant. But listen, all the people who talked about menstrual hygiene, vaginal hygiene, we are told that if you are wiping your anus and you don't wipe well, something happens. You tend to transfer bacteria or microorganisms into the vaginal opening. The same thing is what is happening to this panty. You may wear it and feel good, but you see the string at the side. When you wear it and then you have not visited the closet, you wear and now you are going to visit the closet. You wear it and you are not going to, wee and all of that. As you walk, the strings will be moving from the anus to the vaginal opening, from the vaginal opening to the anus. Are you getting it? Because your movement is like that. So the pants will be moving up and down. So this is it. If there is any leftover feces, if there is any leftover wee, we did not wipe up clearly. What it means is that yes, you may not be sexually active, but you'll be suffering from one of the infections that Dr. mentioned, candidiasis. A lot of unwanted, unusual vaginal discharges. So please, if you wear this one, make sure that you're not wearing it for too long and that you visited the urinal enough, you have visited the closet enough so that you don't have any droppings left at the base. Are you understanding this? Hello? Then again, what makes somebody a lady? Remember, you do not wear your underwear where the pattern will draw behind you. You don't have your beads around where you begin to walk and everybody is looking at you. Is that beautiful? It's beautiful, right? Is that beautiful? So please, you are cautioned to do that. Now listen to this. How do you pronounce M-A-D-A-M? I'm taking it again. M-A-D-A-M. How do you pronounce it? Again? Clap for yourself. Madam, you have no business whatsoever to go and say, madam. No, madam. Why are you supposed to pronounce certain ways you're supposed to pronounce? You enter into an office and then, Philippa, let's do it. Let's do it. Let's do it. Let's do it. Okay. So, I cannot use the microphone because I'll be walking. That's the first one. Have you taken notice of that? So she is in her cloth, right? Let's go. Good morning, madam. Did you hear her greeting? Oh, good morning, oh. Now, let's go. Hi, Philippa. Good afternoon. Now, you have no business. A second cycle, decent, civilized young lady, where somebody will greet you, and then you go like, good morning, oh. Morning, oh. Morning. I said good afternoon. You say afternoon, oh. My goodness. Hello. Are you enjoying it? Yes. Good afternoon. That is not a subject. Never. Good afternoon, madam. Good afternoon. And when you do this, whichever office you are entering, they are forced to lift their head and look at you and give you an attention. You can't go and knock on your headmistress's office. You're not even supposed to go there. Then you find yourself there. Good afternoon, madam. The Kiki I know will not even raise the head to look at you. That is the name we used to call her. She will not even raise the head to look at you. You are knocking on Mrs. Brainpine's door and go like, madam. And then you show all the 32 sets of teeth. Hell no. Look at it. You are not showing your teeth. Madam. Are you getting it? Madam. Let's try it again. Madam. Some of you are trying to. Let's go, madam. Good. Then the last one. The last one. Last but not the least. How do you sit down? How do you sit down? How good? Now you are doing it. Intentionally, we decided not to mind you with how you are sitting. How do you sit down? As a second cycle girl, do you know that your parents are bragging about you? You know that. My daughter is in adult senior high school. My daughter is now attending secondary school. Then you come and you sit like this. You open your legs. Then some of you will fold your skirt in between your thighs. Let's stop that. My lady, come. Come. Okay. Good. Come. Let's practice that. Quickly. So, you see the nature of your check. It is flat, right? When you sit down, you don't fold it in between your thighs. You sit for it to flow on your lap. Yes, sit down, let's practice that. Good. You hold it down like this. Great. Then you cross your leg at the base, not on your thighs. No. Why are we not supposed to cross our legs on the thighs like this? Medical terms, you are putting pressure on this one for a longer time. And sometimes when you are in a short dress kind of, you raise your leg and then you expose what? This back. So you only will have to cross your leg at the ankle side. Are you getting it? Listen, what do you do with your hand? Look at where her hands are. How do you keep your hand? As a classy lady. How good? So, like that. Good. Good. On your lap. So you don't sit in an office and then your hands are scratching all in your ear, in your hair, and then somebody's talking to you, you're picking your nose. Hey. You are not a classy lady. You are not a classy lady. So look at how she's looking. Neither do you sit and then lean in the chair like that. No. You sit straight with your back straight. I like how some of you are already doing it. Good. Right. So have we observed this? So now, wherever you are, get up and sit well as classy ladies. Get up and let's try it. Good. Including those in the inner room. Yes, good. What did I tell you? You don't fold it in between your thighs. Even the skirt, you spread it on your thighs nicely. Cross your leg. Beautiful. How do you do the classy lady is supposed to walk. Now you wear your slippers, you wear your shoe, and then some of you, immediately you begin walking, they know there's a person who is coming. You drag your feet and walk just like this. Really? No. So whether you are in a slipper, in a flat shoe, any shoe, breathe in, hold your tummies in, good, without any stress. Raise your shoulders at the top, go like that. You are still breathing in, breathe out. Good. When you are walking, my breath is in, yeah? So you go like this, and then you look forward, like that. You don't walk. No. You don't talk across the street. Neither do you talk across your wings, your halls, you know, your dormitories. I don't be here and be calling Amma at the last end. It doesn't make you a lady. So every table, just to get me one person, let's practice how to walk. Every group gets me one person. Hurry up, let's do that. Good. Let's go, let's go. Yes, come, let's do it. Let's do it. Let's do it. Yes, so some of you will be walking with your eyes glued to your phone. That is wrong. Great. Stand there. Another group is coming. Great. We are just about wrapping it all up. Good. Let's go. See, sitting in a slipper. Wonderful. Great. Good. So how do we do it? Breathe in. Raise the shoulders. Wonderful. 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 Let's go. Ready? Go. Head up. Head up. Good. Smartly. 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 Let's do it. Yay! And then come back. Let's go. Head up. Head up. Breathe in. Shoulders up. Wonderful. I see you all. Yay. The last thing. You walk anyhow. I think, you know, you are the girl, so you decide to walk. No. You walk with purpose. So smartly. Breathe in, shoulders high. You go like that. It's time for class. You don't wait for your teachers to get there before you be running and be walking anyhow. If I'm the one teaching you, I'll punish you. I get it. So you go, your backpack at your back. Hi, Adwa, how are you? You are walking. You don't have the time to gossip unnecessarily. So the level 300, the form 3s among you, this goes to you. The final one. You are in academia. It's your privilege to have the kind of teachers I had whilst I was here, the kind of senior colleagues that were here with me. You have no business whatsoever speaking Twi or any vernacular language. No. No. Why did your parents bring you here? My father will always brag about me. And it's even wrong for me to use myself. Let me say. I speak the way I speak and it's a talent. So you may not be able to speak the way I do. But we are all unique in our own ways. This morning when we came, and then Dangbe. Can you imagine when you go back to your village and somebody comes and then your father will say, oh, the language you're speaking I can't understand. Let me call what? My daughter. She's a student at Sadan Senior High School. Let her come and explain. No, I'm not going down now for the stop at house. Would that be nice? Is that cool? So from today, nobody will punish you should you speak any vernacular. But say to yourself, even when I get it wrong, I'm still going to do what? I didn't hear you. Even when I get it wrong, I'm going to do what? That's it. A resounding round of applause. Are you happy? Are you happy? All right. Somebody donated a sanitary pass to you. And it's coming from Volta Resilient Foundation. They have a minute message for you. The vote of thanks, the person who needs to give us the vote of thanks should be standing by. And we are ready to go. And right from Volta Resilient Foundation, there he comes. A quick message for the girls.
It's good afternoon. You may leave. Okay, on behalf of the Volta Resilience Foundation, I extend my warm greetings to the organizers and the participants of the biology of the Girl Child Summit. At Volta Resilience Foundation, we are committed to empowering women and girls through skills training, education, and economic empowerment. Our program aims to equip them with tools and confidence to succeed, just as we are distributing the sanitary pad. So we want to advise. Please do not fall prey during period puberty. Thank you to you all, and then for me being part of this program. Thank you very much.
Thank you very much. Nimeli. All right, it's time for somebody to tap us on the shoulder and tell us that we've all been amazing. And to help us do that is your assistant girls prefect, Erica Jaira. Beautiful. Let's welcome and come with a round of applause. Good. Great. Over to you.
The chair, the headmistress, distinguished guests, the gymnast volunteer team, honorable staff members, students present, ladies and gentlemen, on behalf of the school management and the students' body, I would like to express my heartfelt gratitude for the wonderful teachings you have given us today. Your presence here today has and is going to cause great changes in our lives. We are looking forward to having more of your educational and motivational programs here. We believe that as we seek your nurturing and guidance, our life will be groomed well as expected for the future. GMAT Volunteer Network Team, we all appreciate you for devoting your time and effort to inculcate wisdom in us. We all say, Aiko, thank you.
Thank you very much. We can do better, ladies. We can do better. We can do better. We can do better. All right, I broke a little protocol. We have to listen to the closing remarks from the mathematician herself, Dr. Eunice Osei SPA. Yes, her closing remarks. We can do better, girls. Let's do it up. We are just about finishing. Closing remarks from the chairperson of this wonderful summit. Doc, take it away.
Thank you very much. Wow. Are you finished singing? Yes. All right. I'm saying wow. Today has been a very loaded but very, very educative summit and ideas covered. We need to know the essential things in our bags. For example, the pad, the tissue, the hand sanitizer, etc. We should be cautious about our teeth, since it can deny us from even speaking with people, checking our menstrual hygiene very well, and a whole lot of things. All presentations are leading to our personal life, our health, which boosts our confidence. Practicing this daily routine of what we have learned today would empower ourselves and become a classy lady. To our landlady, the headmistress, we say thank you for allowing today's summit being a success. Without giving us this opportunity, or allowing us into your chamber, it wouldn't have been successful. To our summit lead and her team, When I say her team, both male and female, we say AICO for let our girls in our school also benefit from this summit. And just as the assistant said, we hope that at least every 2 years you make a visit by coming here. Maybe yearly or not, but at least every 2 years, make it part of your team and be visiting our ladies here. To our facilitators, we say nyepino. At least for making our day. We wouldn't have known a lot. We have also benefited. And all that we say that our ladies, avail yourself. And all the knowledge that we have gained today will make a difference today and the rest of your life. On that note, I thank you so much for gluing to your seat till this time and making this summit a success. Thank you very much.
Thank you very much, Dr. Eunice Osei SCB. A quick question. Some of you say no. Let's get one and show them right now. Within the next 60 seconds. Because it will be a waste of resources should you not use them rightly. Is that okay? Reusable, meaning that you can use them over and over and over again. Good. So there she comes. Great. Do you need a panty? Yeah. Please bring the grandmama.
Okay, first of all, before we start with this one, just a quick one. The normal part that we all know, this type, the disposable one. And please, after using it, after removing it for disposal, please wrap it very well. Okay, don't litter it around. Wrap it very well. So let's say after using it and removing it, fold it this way very nicely and neatly. And then since you'll be changing into a new one, you see the wrap, you can either use the wrap or get a black polythene bag, a small one. If you don't get the black, you can still use the fold of the new one you're about to use, okay? So you put it in like this and then fold it nicely. You see I didn't remove, I didn't really open it completely. There's something like a bag here. So after folding it, you put it in the bag like this. Look at how I've done it nicely. And then put it in a bin. Do not put it in your toilet, okay? When you do that, it makes it very difficult. If they want to extract the feces and all that, it will get stuck, okay? So fold it nicely like this and put it in a bin. Or if you, after folding it like, if you have the black polythene, you can equally put it in and then discard it. Are we clear with that? Now let's look at the reusable. This is how it is, okay? Okay, this is how it's very foamy. So you put it in the pants. So there are two sides. There is a very smooth surface at the back and then something like a rough surface in front, okay? So you put it in the pants like this. Please, are we all here? So you could see that there is a lock, two locks at the side. When you put it in the pants, you lock it behind. You see the normal one, that one is like a glue, a sticky glue. But this one, there's a lock here, okay? So you lock it at the back, just like this. You have your patch this way. Okay, this is how it look like. Okay, then you use it. After using it, if you change it, it's reusable, okay? It means you can use it again. After using it, you put it in maybe your pail, okay? You pour water on it, and you pour soap on it. Don't use bleach. Don't use any harsh chemical on it, because when you put bleach or anything, parasol on it, it will spoil the whole thing. You might not be able to use it again. Okay, so you pour water and detergent on it, you wash it well. After washing, you rinse it. with clean water. After rinsing, you dry. When you dry it directly under the sun. After drying, you can reuse it again, but don't iron it. When you iron it, you spoil the whole thing. You are not supposed to iron it, just dry under the sun. Okay, then you can reuse it again. All right, thank you.
Thank you very much. Thank you. All said and done. Do you want us to come back again? Yes. You don't want us to come back? No. Do you want us to visit you next year? Yes. Let's do it again. All right, you're ready for the closing prayer? Yes. And then I told you about him, right? Let's welcome Reverend William Y. Accra as he gives us the closing prayer. And when we are done, a short announcement before we leave.
Esther.
Hello, you can use mine.
Esther, did you say we have to dry it? Is it for one person? So please, when somebody is drying it, don't go. Shall we pray? Our Lord and Master, this afternoon we are so grateful. You are the source of all knowledge. And this day, Lord, you have imparted good knowledge to us. And Father, when we have good knowledge, it transcends to understanding. And when we have understanding, we have what it takes to implement it, and that is wisdom. And from today, we are going to see classy ladies. From today, we are going to see, Lord, ladies who are aspiring to get to the top. We are going to see ladies, Lord, who would focus on their books and good hygiene. Every form of laziness is taken off in Jesus' name. Amen. We pray that, Father, let this wonderful seed that has been sown today grow and bear fruits, so that in the next 3 years, in the next 5 years, they would come back and be good testimonies. We also pray, Father, for our sponsors, all our facilitators. We pray for traveling mercies. We also pray that, Lord, you would push them higher, and at the end of it all, your name will be glorified. Thank you. In Jesus' name, amen.
Amen. A round of applause. Thank you, Rev. This has been Biology of the Girl Child Summit. We came to live from the auditorium of Adan Senior High School. Over 1,500 girls benefited from this summit. Let's give it up for ourselves. Esther Osei Esbe Obama Eunice Vima Osei, you have to sit up right now when we are done. All ushers, we are also meeting right after here. Debaters, after lunch, please. Your leader, your teacher is at the staff common room waiting for you. So you are not done. The day is already packed for you, yeah? Our pictures, what do we do? We have networking right now. We are done. So all the girls in the white t-shirt, you pose with the facilitators, with the chair, with your headmistress outside. And then when we are done, we're picking all the green, the checks. Those of you are also available. We take that. Then we take all of you with the sanitary pad. We arrange ourselves at the front part of the auditorium and also pose for the cameras, right? All right, my name is Fortune Nokoko Adalabo. This has been